Good evening, fellas.
Yeah. Another
What's
Thursday
happening?
night.
Dr. Joseph Rosado, how are you?
I am excellent. How are you?
Hey,
I'm doing all right. I think we're going to get into some fun topics tonight. So,
Yeah. Welcome to
stuff
the
that's near and
Thursday
dear to
night
us.
show.
It's 86 degrees down here. How is it up there?
we had
It's
a
not
little
bad.
ice storm this morning.
Yeah, our schools got canceled this morning because of absolutely no reason
No,
whatsoever.
absolutely no reason.
Like,
It drizzled the other night. It possibly froze
Yeah.
overnight, and people got scared.
yeah. This was hardly a reason to cancel school, but anyway, yeah. So it's not that cold or not that warm down up here. So that's
A
that.
little
But
jealous.
yeah, exactly. That's, I'm a big skier and I love winter because I get to ski like all the time. But like right around now, I'm like, okay, February is like getting closer. We're over halfway done. Is it time to start thinking about surfing? Like, are we, like, I'm like, skiing, I liked it. It was great. But, is it now time for the next thing? I
Oh
don't know.
man, skiing to me, even if you're standing, is just falling down a mountain.
Yeah, I know. A lot of people say that.
Even if you're on your feet, you're just still falling down a mountain.
Funny enough, I got these two great things the last 2 years from a ski store in Orlando, a ski shop in Orlando.
Big skiing in Orlando.
Yeah, it was.
Oh, yeah, it's huge. Water,
Yeah,
and
Yeah.
not much of anything else.
It's absolutely funny. Just an online store, but it's from Orlando, I think. Almost positive. And it's just funny. I'm like, I accidentally got something from there twice, and I got the email. I'm like, seriously, Florida? Like, what's? I don't know. I don't know.
Cheap warehouse, maybe.
Yeah,
You know?
exactly.
Yeah.
So, hey, Doc, listen, like I said, thanks for coming. I wanted to just jump right in. But first, before we get into what you're doing, I kind of love to hear a little bit about how you got to where you're at and, just kind of walk us in that way.
Absolutely. So I am the atypical medical doctor in that I went the long way, and you'll understand why here in a minute. So I knew early on that I wanted to be a physician, and if you've read my book or one of my books or have not, in the book I go into when I decided I wanted to be a physician. Really cool story, and I honor the individual that was there to support my trauma because, as a young kid, I was traumatized by healthcare. And this pediatrician took it upon himself to kind of break that mold. And so, I acknowledged him in that portion of the book. But I already knew early on that I wanted to be a physician. So in high school, at the ripe young age of 15, they were offering a course to be a certified nurse's aide. Now we're talking about 1977, latter part of 77 into 78. And I went ahead, took the course, and the requirement was you took the course, you passed the course, and you passed the final exam, you were automatically licensed as a nurse's aide. And once you turned 16, you could be an orderly. And so at the age of 16, I was already a CNA, certified nurse's aide. And so I'm working at an assisted living facility, and I was the only guy working at the assisted living facility. So what my job was? Every 2 hours, I was going room to room, moving these, residents. Not a whole lot of learning going on there, guys. Just a whole lot of moving, a lot of, muscle work. And I'm like, no, it's cool that I'm working with people, but it's not really what I'm about. So fortunately, right around the time, a hospital here in the Central Florida area was hiring transportation orderlies, people to pick patients up in their rooms, take them to the X-ray department, have them do their X-ray procedures, and then take them back up to their rooms. And what was cool about it was that during downtime, I was able to sit by the side of the radiologist as they were reading the X-rays. So I'm seeing X-rays and I'm watching the anatomy as they're describing the anatomy. So I'm taking, I've got an anatomy course at the age of 16, 17, 18 at the foot and lap practically of these, seasoned radiologists. And they're pointing stuff out to me and I'm seeing pathologies and fractures and, already at that young age. So I'm just soaking this up. So I'm loving it. It's great. Everything's cool. I'm set, graduate high school. I'm going to Mexico because, they've got a program that you do 1 year undergrad, 4 years medical school. They've partnered with a school in California, and you graduate, you do your fifth pathway, boom, you're back in the U.S., and you do your residency, you're good to go. I love the idea. Mexico didn't love me. And so while there in that 1 month, I contracted salmonella, shigella, amoebic, dysentery, bilateral kidney infections.
What the hell did
typhoid
you eat?
fever.
Yeah, really. What the fuck were you doing? Yeah.
No, I only had those little, icicles on the street corner.
Yeah, I was just gonna say.
the paletas.
Yeah.
What's
Oh
wrong
my
with
God.
that? I mean, they were coconut flavor, they were pineapple flavor, and they were strawberry flavored. They were great going down, not so much staying down.
Yeah.
And so we had that situation. And then in the school itself, they had to have a process for cleaning the fruits and vegetables. And a lot of times when the lines would get long, they would shortchange those processes. And so that's how I ended up with everything that I contracted. So in the 30 days that I was there, I was in the hospital 7 of those 30 days.
Oh my God.
And so, 25% of my time was literally in the hospital. And so
And not the way you wanted to be.
Yeah.
No, not at all.
And not in the fun way.
not in the, hey, I'm learning stuff way.
Yeah.
So there was this lady that had, become friends with my mom and was in communication with my mom. And so she goes to the doctor and says, hey, I'm going to assume responsibility for this student, I'll nurse him, whatever needs to be done. And they're like, no, you're not doing that. And she's like, well, why not? I said, because we're waiting for his fever to break. My fever was 40 degrees Celsius, which is 105 here in Fahrenheit.
Jeez.
And so they wanted to wait for my fever to break to 39, put me on a plane, ship me back to Florida so that I could die here and not there and not be a statistic in their hospital.
Wow.
So yeah, it was pretty messed up. So it took about a year for me to recover. And so while having dinner with one of my good friends and his girlfriend, she was a nurse at the hospital where I had been the transportation orderly. And she's like, why don't you guys consider doing the EMT course? And I'm like, that sounds interesting. So following day, I contacted the community colleges in the area, reached out to them, visited the schools, spoke with the directors, enrolled in the EMT program, loved the idea of being an EMT. Everything resonated, took my boards, passed them, and then went on, became an EMT intermediate, then a paramedic. So now I'm nurse's aide, EMT, paramedic. I get fried. I mean, on the street in Central Florida, right around early mid-'80s. You guys may remember or may not. I don't know how old you guys are, but there was something that went down right around the 80s in the United States. You guys remember what that was?
AIDS? Was this AIDS?
That, but something, street drugs. Let's talk street drugs.
Oh, crack.
Crack.
Yeah,
Crack
New
cocaine.
Jack City. Yeah.
Yeah.
You mean the CIA released?
Yeah.
That's okay. They're getting defunded.
Yeah.
So yeah.
Oh man.
So crack hit the city hit Old Town, Mickey's World. And in one shift, we lost 4 kids because we had no protocols. We had no
Narcan, nothing.
Narcan wouldn't have worked on it, number one.
Yeah, well, no, but I'm saying there was no...
there was no antidote. And the treatment that we had, because the heart rhythm that these kids were going into, the antidote for that and the way to treat it was a relative of cocaine, lidocaine. We gave people lidocaine intravenously to treat ventricular fibrillation. So now I'm thinking, wait a minute, I can't do this because they both end in cane. Cocaine, lidocaine, procaine. I can't use this. And so we're calling our medical director going, dude, what do we do? And so they're investigating, and we knew what the treatment was. We just didn't have it in our drug boxes. So more and more people were dying. And I'm like, look, I didn't sign up for this, especially, 17, 18, 19-year-old kids. This is not right. And so right around that time, the hospital again, where I worked as a transportation orderly, they were starting a pilot program where they were bringing on paramedics, respiratory therapists, critical care nurses, to be cath lab technicians. And so it was on the job training to work in a heart cath lab doing heart caths. And there were 22 different cardiologists that were involved in the cath lab. And there were 4 labs. And so again, very similar to my experience as a transportation orderly doing, watching x-rays. Now we're doing heart studies where we're injecting dye into the heart. We're seeing blockages in the arteries. We're opening the arteries with angioplasties, putting balloons inside people's arteries, doing
crazy.
electrophysiology studies, putting in pacemakers. I mean, just cool shit. Like really, really.
Yeah.
You've been working your way up, kind of trying your hand at almost everything. It
Yeah,
sounds
this hospital won't let you go. They're like, shit, what can we make this guy do next?
like. Yeah.
Like this.
Hey, by the way, we also have this stamp collecting program.
Yeah. Wow.
So here I am involved in this. I'm pre-med, getting ready to go to medical school, hanging out with all these cardiologists, learning about the heart, like in ways that I'd never dreamed or imagined. I'm stopped at in front of a laundromat. I'm getting ready to go and pick up my martial arts uniform because at the time I was competing in the state of Florida. I was ranked in the state. I was number 4 for my rank and weight. And so I'm ready
In
to...
what discipline?
Yeah, I was just going
At
to say
that time, I was doing Taekwondo.
Okay.
And so I was a brown belt, and I was getting ready to go in, pick up my uniform, because that weekend was the final tournament of the year, and they were going to decide. And they were like, we were all really, really close to each other. So it was going to be decided who was going to be 1, 2, 3, and, who was going to get trophies and who was going to get a handshake. No trophy for participation whatsoever. So it was 1987. So I'm stopped, making a left-hand turn. I'm in a Datsun B210. And out of nowhere, my car shuts off and my neck jerks back. And I'm like, what the hell just happened? And I look in my rearview mirror and I see smoke coming out from behind my vehicle. I'm like, what the hell had just happened? And it turns out that a 16-year-old kid was driving his dad's Delta 88 in Oldsmobile. I did say I was in a Datsun B210. He won, obviously.
Yeah, just by sheer mass. Yeah.
He was drinking a milkshake, dropped the milkshake, and he bent over to pick it up, left his foot on the gas. My vehicle stopped his vehicle. And so I was a paramedic, still at the time. And so when the paramedics that came on the scene showed up, I knew these guys. And, I'm a bit of a jokester. And so I tell them, that's my mom.
Yeah. Hello.
So I'll get into her story here in a minute. But anyway, so they're like, yeah, right, Joe. I'm like, no, seriously, I'm not feeling my legs, guys. And they're like, yeah. So grabs a needle, sticks a needle in my leg, and I look at them like, yeah. And they're like, oh shit, don't move. Wow. So they pack me up. I'm in my mid-20s. And so immediately take me to the emergency room. I'm in spinal shock. They give me, loads of steroids. Within 24 hours, now I'm getting pins and needles in my legs. And they're like, okay, our job is done. Bye.
You've improved.
Yeah. And I'm like, wait a minute. Something's not right here.
Yeah.
And so I leave and I contact a chiropractor that I had gone to see for a sports-related injury. I go into his office. He retakes the x-rays. He tells me, hey, did you know you had a compression fracture in your spine? I'm like...
And this is a fresh compression fracture, right? This is from the accident.
From the accident. It's like fresh 2 days old, 3 days old. And I'm like, no, I didn't know that. He's like, yeah, here it is. Look, it like freaking pancake. I'm like, holy crap. He's like, don't worry, we'll take care of that. I'm like, well, how are you going to fix a compression fracture? He's like, no, we'll work around it. We'll be fine. Well, sure as shit. 2 weeks later, I was no more numbness and tingling. My flexibility was coming back. My strength, I was gaining my strength. Needless to say, I did not compete that weekend at the tournament.
Probably.
That did not happen. And so that's when I decided, no medical school for me. I'm going to chiropractic school. So I enrolled in Life College, Marietta, Georgia. Now it's Life University. And graduated, with honors, everything else. Loved what I was doing. Everything was great. Practiced for 5 years. Got an amazing job as an associate doctor in Ohio, working in Amish country. So I was deep into that Amish community.
Who were you working for? Just
Dr. Russ Pavkov,
Okay.
P-A-V-K-O-V.
All right.
Russ
I know
Pavkov.
somebody out there that's not him.
No, it was his office. When he interviewed me, it was crazy. It was it's Sterling, Ohio. The population at the time was 500. There was
Wow.
a flashing light in the center of the town. It had a bank, a gas station, and something else. I lived in Worcester, which is, the home of Rubbermaid, and then Worcester College and Rubbermaid. And then from there, I moved to Orville, which is, Orville Redenbacher
Yeah.
and
Popcorn,
Smuckers
dude.
were there. So that's right. I was there. Hated the winters, though. So I ended up in Arizona. Got to Arizona. I wanted a predominantly Hispanic practice, being bilingual, bicultural. So I started working heavily with that community until one Sunday morning, I get a page on a beeper. Yes, beepers.
I had one too, man,
With
Yeah.
911.
for different reasons.
Matt wasn't doing any healthcare. Maybe.
Yeah, you had special
Now we
code.
call it healthcare.
Street chemist.
Yeah.
So I get this call on a Sunday morning with a 911. So I call, and it's this gentleman, Ruben, and he's like, "Oh, I'm calling you about Annie." And I'm like, "What's up with Annie?" And he said, "Well, she's got that problem with her thyroid. She's got a goiter. It's enlarged, and she, spikes fevers when she's not feeling well. Well, she's got a really high fever, and when she was a little girl, she used to have febrile seizures. She would have seizures, and we're afraid that she's going to have a seizure." I'm like, "Well, why are you calling me? Like, call her pediatrician." They're like, "Well, she doesn't have a pediatrician." I'm like, "Okay, we'll call your family doctor." It's like, "You are our family doctor." I'm like, "No, I'm your chiropractor from your car accident. I'm not your daughter's medical doctor. I can't do anything about this." And he's like, "You're the only healthcare professional we have." And I'm like, "Okay, well, why don't you go to the emergency room?" He said, "Well, we're illegals, and if we go, they're going to report us and they're going to deport us." I'm like, "Shit, man." I'm like, "Look, as a chiropractor, I can't tell you to give her or not give her anything. It's out of my scope of practice. I'll get in trouble." I said, "I can treat her like you're my friend, and I can advise you like when I was a paramedic. So, give her a tepid bath. Don't give her an aspirin. She could end up with Rye syndrome. Give her acetaminophen. Don't rub alcohol on her body. I know it's big in our home, in our home countries. You don't want to do that. Leave the Vicks vapor up on the mantle. Don't put any Vicks." I said, "Give me your address. Let me go. I'll come over, check you out, and see what's going on." I said, "But if she sees this, dial 911. All bets are off. Forget it." So as I'm turning onto the street where they live, I see the ambulance pulling away, and I'm like, "Shit, she seized." So I get to the front of the house. Mom's in the front lawn waiting for me. She's like, "She seized." And I'm like, "Okay, get in the car. Let's go." And so in the car, I'm like, "Look, I'm just your translator. I'm nobody. I'm just Joe translator." So we get to the hospital. I pull Dad aside, Joe translator, nothing else. "Okay, no problem." So now I see this little 7-8-year-old girl, like full on intractable seizure, what is called status epilepticus. She's just nonstop. They're giving her stuff. Nothing's working. They're giving her shots. They can't get an IV on her because she's like thrashing about. So they start an IV on what's called an intraosseous line, where they go into the bone, start and give her the fluids that way. So they're giving her medication that way. Nothing's touching this little girl. Nothing. She's peeing on herself. She's crapping on herself. She's like foaming at the mouth. It's like, wow. And at the time, my wife at that time was pregnant and with twins. So I'm thinking, man, now I'm thinking as a dad,
Sure.
And so all this stuff is running through my mind. Finally, they get her under control. They get her calm. Social worker comes in, translators come in, everybody's fine. The rest of the family shows up. So I exit, stage left. I get to my car. Now I'm pissed. And I'm so pissed that I start to cry from anger because I'm a doctor, but I couldn't help them. I could not be their doctor. And I'm like, I'm never going to be in a situation where I can't do something for somebody. I'm not going to have any more limitations in my life. And so this was a Sunday. Monday, I pulled out the Yellow Pages. Yes, Yellow Pages. There was no Google in 1995.
Sure.
And so I called Kaplan. I looked test prep. I contacted Kaplan and Princeton Review, enrolled, took the MCAT prep, took my MCATs, did relatively well, got interviewed. And then I realized how expensive medical school was in the United States. We were talking about between $30,000 and $50,000 a year. And that was just
in the 90s. Yeah.
And that was just tuition. That wasn't books. That wasn't room. That wasn't housing. That was nothing. I've got a wife and 2 kids coming. I'm like, I can't do this. So I have a cousin who's a physician, lives and works in Spain. I reached out to her. Her husband was the dean for the medical school in that community. And so I spoke with both of them and about going to school in Spain. And they're like, no, you don't want to come to Spain. I'm like, well, why not? It's like, well, they're in talks about creating the European Union. Spain and Portugal are the 2 poorest countries. We're going to get the shitty end of the stick. The economy is going to be a mess. You don't want to come here. Go to the Dominican Republic like I did and get your degree, take your boards. The world's your oyster. And I said, well, where do I go? What do I do? And she's like, well, I recommend these 2 schools. This is where I went. I'm like, okay, done. I reached out to the schools, went to Dominican Republic, interviewed at both, got accepted at both, went to the school that she decided to go to. So now we got orderly, EMT paramedic, cath lab technician, chiropractor, medical school. So medicine was my 6th career, hence the long way.
I was just going to say, man, I'm like, is he telling us that he went
did you bring your wife with you?
Yeah. At the time,
wow.
Yeah.
Okay.
And the kids, both.
And the kids.
All
Okay.
3.
Wow.
And so this was in fall of 1997 was when I started medical school in the Dominican Republic, San Pedro de Macorís, where Sammy Sosa
was a
lived.
junior in college. He's had like 8 careers. I
think I just started the acupuncture program.
Yeah.
Maybe that was 98. I don't remember.
Well, in 1998, we got hit by Hurricane George. And so we, the uncertainty of what was going to happen or whatever. So the wife and kids returned stateside. I stayed down there, came back to the United States for the holidays, and was promptly handed divorce papers.
Yep.
Yeah. So I had nothing else to do in the Dominican Republic because I don't play baseball. And in San Pedro, you either play baseball or you go to medical school.
Little too late to get into the baseball career. I'm
Yeah,
going to close that door for you. Med school, fine.
Atlanta just signed a 16-year-old. So
yeah.
I was in my mid-30s by then.
No, you were already past retirement. But
Yeah.
No.
So I just became obsessed with everything that was medicine. And so I started, like going to the top doctors, hanging out with them, shadowing them, and learning as much as I could. And that's what I did. And I graduated, took my boards, and then from there, like my cousin told me, the world truly was my oyster. I worked in Costa Rica as one of the team physicians for the Costa Rican Institute for Sports and Recreation. I worked with athletes, Olympic athletes there. I worked with the FIFA men's and women's national teams. I got involved, worked with a lot of young athletes, but as well as professional athletes. Did clinical trials and research in Puerto Rico for diabetes. Did bioidentical hormone replacement therapy. And then in 2010, one of my really good friends reaches out to me and says, hey, Joe, medical cannabis became legal in Arizona. And the rule in Arizona is that I have to have a medical director to oversee my dispensary. I've got the land, I've got the property. I want to grow. I want to set up a dispensary. I want you to be my medical director. I'm like, say less.
That seems a lot easier than seeing patients.
Yeah.
That seems like an easy lift.
Yeah. I will be right there.
Hey, what do I have to do? You have to say I'm a doctor. Okay, I can do that.
Well, I can do that. So we're all set. We're ready to roll. My daughters are 14 by this time. Their son is also 14 because their son is about a week and a half older than my girls. We were all living in Arizona at the same time. And so I start doing the process to get licensed in Arizona. And his wife, who's from the Midwest, love her to death, Jan, she's like, oh, Don, I don't feel comfortable doing this marijuana because we're telling the girls and Adam not to use marijuana, not to do drugs. And so he's like, well, call Joe and tell him, because he's like all set to move over here now.
Yeah.
Like, what do you mean? So she calls me up with her little, twangy accent. I'm like, look, Jan, this isn't Joe and Don selling weed on the street corner.
Yeah.
This is
Right.
Dr. Rosado and Dr. Dearth. He's a chiropractor. I'm a medical doctor and chiropractor. Like, we're going to be dispensing medical cannabis. No, Joe. So scratch that project. So back to the drawing board.
Oh, no.
Oh, no.
That's
forward.
tragic.
Yeah, very tragic.
Yeah, because I mean, you're right there. I mean, you're on the cusp of all of it.
Yeah, 2010, because the first state to become legal was 1996 in California. In 1999, while I'm in medical school, I'm a freaking unicorn because I learned about the endocannabinoid system. I'm learning about receptors.
Well, they just discovered that in 91, so you're still like pretty damn ahead of the curve. Yeah.
Yeah, anandamide was discovered and named in 92 by Lemur Hanush, who's the one that wrote the foreword to my first book, the first book I published.
Wow, that's awesome.
Yeah.
Good get on that, huh?
And I love that because Ananda is bliss. I mean, how could you be more like...
Yeah, exactly. So in 99, I'm learning about the endocannabinoid system in medical school. Less than 10% of medical schools, as you know, in the United States and possibly the world, teach about the endocannabinoid system. So, but of course they went into, it's a gateway drug, blah, 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 and you're going to end up shooting up. Yeah, whatever. So that night I went home, read my pharmacology book, Goodman Gilman, and pulled up Cannabis Sativa, where I learned that no, it's not a physiological dependence or addiction, it's a psychological dependence. And I'm like, so it's not like alcohol or opiates or benzos or cocaine, which I've seen people do. And it took me back to my paramedic years, dealing with crack cocaine.
Dealing with OD,
sure.
And overdoses with the Narcan, because we didn't have the Narcan nasal spray, but we, had the IV push where we would, you'd either put it down in an endotracheal tube, like we'd intubate them and, shoot it down the tube or whatever. Anyway, so nothing there because it's illegal. Fast forward. So Don reaches out to me in 2010. That's a no-go. 2014, John Morgan, a very lucrative and popular attorney in the state of Florida, starts advertising for the decriminalization of medical cannabis and putting it on the ballot, known as Amendment 2. To go up before the ballot in 2014. Constitutional amendments in the state of Florida, I don't know how it is in Maryland, but here you have to have 60% yes vote.
Yeah, it's pretty steep down there in Florida. It's nowhere near that up here.
For it to be a constitutional amendment. So we needed 60%. So I see the commercials. I send him an email on a Sunday, and I'm like, I'm a physician, I'm an advocate, how do I get involved? 24 hours later, I'm speaking with the campaign manager. A week later, I'm on the Bureau of Speakers. And the rest was history. I start promoting, advocating. We have no laws in the state, gentlemen. There's no laws. We have no product. It's a pipe dream is what we have. That's all we got is a dream. June of 2014, they created the Compassionate Care Act, which was Senate Bill 1030, which allowed low THC for 4 diagnoses, which were cancer, epilepsy, chronic conditions that cause seizures, chronic conditions that cause muscle spasms. That's it. Nothing else. Low THC. Did I say that? Yes. Mind you, no grows, no laws to grow, no hemp.
How are you getting it? What was low THC considered?
That was going to ask.
Are we talking about 70s skunk weed? Or are we talking
low THC in the state of Florida is defined as 7% THC or less.
Okay, and were they savvy to where like, we know THCA gets converted, or were they?
Dude, it was on paper only, and I'll tell you why.
Okay.
It was on paper only.
This was on a napkin from a bar.
It was a strategy that was created because when the opposition came around in November of 2014, they're like, "There's already a medical marijuana law in the books. What do you need another one?" And they used Senate Bill 1030 for us to not get the 60% that we needed. We lost by 2%, less than 2%.
Yeah,
So,
that was tragic. I was talking, I got a bunch of friends down in Florida that were all like,
oh, it was ridiculous. So fast forward, so back to the drawing board, back to 2016. But that was to my advantage and it was in my favor because it allowed me to learn more about it. And so on my dime, I started traveling and shadowing people that have been doing it far longer than me. I went to Colorado with Margaret Getty, who like deals with pediatrics and recommends CBD and THC for kids with seizures and cancers and everything else. Read everything I could get my hands on from Ethan Rousseau, Dustin Sulak. Of course, read everything that Rafi Meshulam had to write, and of course, Lumir Hanush, which is a cool story how he and I met. We were in Colombia. I was invited to go speak at an event in 2018 in Medellin at Canada World Congress. I'm standing in line. I hear the guy in front of me. We're in line to get interviewed. And the gentleman in front of me, I hear he's got a really, really thick Czech accent. And they bring a translator over. I'm like, look, you're not going to be able to translate for this gentleman. If it's going to be medicine and with that accent, you're not going to be able to do him service. Let me do the translating. And they're like, oh, no, you're the doctor. I'm like, who gives a shit? I'm the doctor. I'm also bilingual, bicultural, and I'm a medical doctor. I know what I'm going to be saying. And so the gentleman turns around and says, well, thank you very much. And when I see his face, I'm like, oh, Professor Hanush, I'm not worthy. And though we hit it off, and then that's when I asked him to read my book, to be a beta reader. And then he read it, loved it, approved the book, and then I asked him to write the foreword, and he agreed to do so. So back to 2016, I'm traveling, learning, understanding. I get on the application for one dispensary that's opening 2 dispensaries in different regions of the state. That doesn't happen. The law goes through. We get 72%. We're off to the races. In August of 2016, fortunately, because we have the Right to Try Act, I was able to recommend cannabis to 2 terminally ill patients. One was a 35-year-old female with a stage 3 brain tumor. The other was a 15-year-old boy with a stage 4 head and neck tumor that had been told by St. Jude's, don't bring him here anymore. We got nothing for him.
St. Jude's turned him away.
wow.
After the 3rd trip. And he was in hospice and was on a morphine pump getting 16 milligrams of morphine every 4 to 6 hours with the capability of giving himself a bolus of morphine for breakthrough pain. We started him on a 1-to-1 CBD THC oil, and within a month, we dropped his morphine dose from 16 milligrams to 8, and he was no longer needing that breakthrough relief, which today I read an article that was published January 31st about states that have an adult use recreational program, how the percentages of narcotics have dropped, and how, Medicare had stated that 25% of opiate prescriptions were lower in states that had a medical cannabis program. This was on states that had an adult use recreational program, and dropping anywhere between 26 and 32% decrease in the use of opiates, narcotics. And so now this kid's able to not be in his hospital bed, in his room, drooling, looking at his crotch. Now he's in the living room asking, Mom, make me some rice, beans, and meat because I'm hungry. He's laughing, joking. He was the best man at his brother's wedding, danced with his sister at his brother's wedding. And we started him in November. And yes, he did transition in February the following year. But the quality of life that he got,
exponentially better.
Sure.
And that's the memory that the family's going to have. Because he was the first kid in the state of Florida and she was the first patient in the greater Central Florida area, that made news, mainstream, social media, everything. And so now parents were traveling from the Panhandle in Miami with their kids with intractable seizures, with cancers, with all kinds of stuff for Dr. Rosado to see and evaluate them. Now,
that's pretty impressive.
The Compassionate Care Act, let me tell you what compassion it did not have. You had to establish a doctor-patient relationship over 90 days. So people had to have seen me 90 days before I could make a recommendation for 45 days, a 45-day recommendation, only 2 modes of administration. So they could either inhale with vaporization or use a tincture. If I wanted to give them capsules, I had to remove one and add another. It was an absolute shit show. Do you know how many people died in those 90 days waiting to get?
Crazy.
It was nuts. And people were calling the office, and we would tell them the law says that you have to come in, like today would be your day 0 or day 1 really. Then you come in on day 45, and then on day 90 is when the doctor can give you your recommendation. And their response was, I don't think I'm going to be around in 90 days. I need relief today. But I could have given them a prescription for dronabinol, which is synthetic THC that you can buy at a pharmacy, and within 90 minutes, they would have had it in their pocket.
Yeah.
Not a whole lot of compassion there. And so that was fortunately changed. And so we then got we didn't get Amendment 2 the way it was written. They came up with Senate Bill 8A. We didn't have any smokables. So there was no flower allowed. It was just tinctures, oils, vapes. That's it. And then in March of 2019, a month before I was getting ready to launch my book, the law changed in the state, again, thanks to the attorney I mentioned earlier, John Morgan, who sued the state of Florida and said, this is not what we signed up for. And so he sued the state. The governor, who had just gotten elected, he replaced Rick Scott, who we have now, Ron DeSantis, and he called John Morgan and said, okay, look, if you remove the lawsuit, I'll free the flower. And he's like, okay, do it. And so
that's it. Yeah.
And that was it. And it was that simple. So my book was getting ready to publish. I'm like, stop, hold the presses. I got to change this chapter.
Right.
So changed everything. And then the book came out 4/20, not an accident, of 2019. Of course,
that makes sense.
I'd be disappointed if you told me, oh, just coincidentally.
We're holding until April.
Yeah.
And so 4/20, the book came out. And, but on 4/19 on Amazon, it was already #1 bestseller for alternative medicine, epilepsy, and multiple sclerosis. And that opened up, like that, the floodgates opened up.
Yeah,
That's when I started getting invitations to Malaysia, Fiji, Thailand, Colombia, Mexico, Costa Rica, etc.
Yeah.
That's
Doc,
crazy.
can I ask you something? Because this story is damn compelling.
I mean, yeah, it's crazy.
But the synthetic, the drug manufactured versus the plant. I mean, clearly can't have the same terpene profile, can't have the...
There is none.
Yeah.
There is
none.
It's
just pure THC then, right?
Exactly. It's pure THC. And the patients that get that prescription, because I get a lot of referrals now from hematologists, oncologists, cancer specialists, they're like, and pain management doctors, because the literature is out there. The proof is in the pudding. They're seeing that people that use cannabis drop the need for, opiate use by a factor of 4. So if you're taking 4 oxys a day, you are now able to take 1 oxy a day, because if you're using a short acting, an inhaler, whether it's a vape cartridge, a vape concentrate in wax rosin crumble, or if you're using a pre-roll or a ground or whatever, 2 to 3 hits of that within 3 to 10 minutes, pain's under control, and you're going to be under the effect for 2 to 4 hours, which is about the same as an oxy with acetaminophen or hydrocodone with acetaminophen. So
I say,
like a category 3 kind of.
Yeah, no, well now they're all category 2s.
Category 2s now. Okay.
Yeah, they're all category 2s, including in fact tramadol. They moved from category 3 to category 2. Buprenorphine remains a category 3 because I'm certified to prescribe Suboxone or Subutex.
Okay.
Which is
why they draw the line there though? What's different about that?
Because that's used for medication-assisted therapy to get people off of narcotics.
Okay.
So even though buprenorphine can be used for pain relief, it's also used for meth.
Yeah.
And so that's a Schedule 3, but anything like hydrocodone, oxycodone, immediate release or extended release are all Schedule 2s, together with your amphetamine-based ADD medications. So your Adderall, Vyvanse, Concerta, Ritalin, etc. They're also all Schedule 2s. So But yeah, going back to your comment about synthetics, people that get prescribed that or had been getting it prescribed by their hematologist, oncologist, when they came into my office, they're like, this is crap. I hate the way it makes me feel. Because there's no entourage effect. You nailed
nobody's
it.
guiding there. Yeah, it's just straight drug. Yeah.
It's just straight 2.5, 5, 10 milligrams of straight, unadulterated, chemically created THC. So there's nothing, there's no CBG that is 5 times as powerful as CBD as an antioxidant, anti-inflammatory. There's zero CBD as an anti-inflammatory. There's no terpene profile, so no beta-caryophyllene, no pinene, no linalool to calm them down. None of that.
Right.
None of that.
So now so it's funny, and it's funny, we don't talk about when we talk about medical cannabis, so many times we actually are talking really about not medical cannabis like you're talking about. We're talking about like the subtleties of a myrcene dominant strain to keep you sort of sedated, right? Like that's medical marijuana in most people's terms. So it is, I had to check myself when we first started going down the rabbit hole here. I'm like, oh, this is no actual medical. Okay, hold on. We got to switch gears because like
we're not really treating stuff.
Yeah, like you're actually treating something. Yeah, I mean, not to diminish that, because I talk to many people, my kids, everybody. Like cannabis is very targeted for me. I know what terpenes do what, and I use it. I'm not going to say every now and again. It's not like a recreational thing, but 99.9% of the time, I'm on a mission, right? Like I'm going this direction, I'm going that direction, I'm going this direction. And I know it. I've done a ton of research. I used to take pictures of the labels on the back every time I got a new strain.
He owns headshop.com.
And I own headshop.com. So I was really into it, and I only consume through vaporizers of flower, right? And the reason I do that is two. One is I do like the flavor profile much better, but two, you could look up charts of what temperature all these various terpenes express at, and they're all very different. And if you're just lighting it on fire, you're skipping right to the ones, you're skipping right to the end.
You're just my own heart.
Torching everything, right?
Yeah. I use the Ariser Solo 2. Disclaimer, I don't get any money.
No, I like them too. I don't get any money either unless you buy one from my site, but I will tell you that's not my favorite. We can go into a couple if we want to go down that someday.
Headshop.com.
Yeah. Brought to you by Headshop.
Well,
use the code Irreverent Health.
When everything was starting here, all we had really was the Volcano, which
I've got 3 of them sitting right here.
That's still a bestseller, man. That is still a bestseller.
Which is a fucking anchor, and I didn't want to be lugging that around, number one. And
it's not a portable vaporizer.
Yeah, and the other was the PAX 3. And when I compared them,
I got a PAX 2 somewhere over here.
When I compared them head to head, I was able, the temperature range was greater in the Ariser as compared to the PAX, which is why I made the decision to go that route, because then I would be able to vaporize and be able to tap that 55 degrees Celsius to get the CBGA to CBG, and then heat it a little bit more, and then take it to the decarboxylation of the CBDA, THCA, and then heat it up a little bit more and get to that CBN. So now I'm playing with the different, and then also with the terpenes, but then not only that, but then also mixing like rosemary or thyme or basil, which also have the same terpene
profiles. And cinnamon. I will tell you, if you're on this trail, man,
so you're putting that into like the bay as well. How much?
I grind it. In my grinder, I grind the flower, the cannabis flower, but then I also add these other things to it. So now I've created my own blend.
That's worth the whole fucking 130 episodes we've done. I mean, I don't understand why I didn't think of that myself. It's fucking genius. Sorry.
It's funny though, so hold on real quick. I want to make sure I tell you this. If you're on this trail, Storz & Bickel came out with their first product in like 15 years, and it's called the Venti. It's literally a volcano in your hand. It heats up in under 10 to 15 seconds.
Does it inflate the plastic bag?
No. It's in your hand.
Okay.
Just in your hand. Temperature gauge is on there, but it's the same heating technology that's in the volcano. So you just said you're tethered to this. Not anymore. It's brand new. It not so much brand new anymore, but it's newish. I think it was last year they came out with it. But my point is like now you can get that medical grade temperature control out of a handheld unit. Just thought I'd let you know. Almost nobody knows this thing is around.
And Vendi, VENDI?
VENTY.
TY, Venti. Got it. Okay.
Yeah. But it's really cool. I'll talk to you about it after the show. I can tell you some tech on it. But yeah, it's why is that, right? Because people are starting to know that, right? Not non-medical side real quick, right? People are starting to actually appreciate that. And everyone that I've tried to educate about, terpenes and playing with your, like Tom and I say N of one a lot on this show. And when you're doing the N of one with cannabis, you got to take pictures of your terpenes. You got to keep a log of your terpene like how it expresses. And you have to actually know a little bit of science. You got to know that these express down here and these express up here. And you got to know what you're looking for. You just went through the whole cycle up. People who've never done this, I just tell them straight up, hey, start at like 370. You're not going to have nothing's going to come out of your mouth, but it's going to taste like better than anything you've ever had. Then when when it's feeling a little flat, bump it up to like 380.
Yeah.
And just you can go all the way up to like 420 before it's like basically dust. But each step is a new experience.
You're getting another flavor profile, another
new flavor profile, new experience, new, everything, right?
And that's really similar to what I do for like a few of the patients that, and it's a hard lesson for them to understand that they have cannabinoid receptors in their lungs and that it is okay for them to inhale. And the fact that THC is 20 times more powerful than aspirin as an anti-inflammatory and twice as powerful as cortisone as an anti-inflammatory. And when you use an Advair, all you're using is a long-acting bronchodilator and a steroid. So just inhale cannabis, and I'm walking them through this slowly, but I'm getting them there. But for those that are like, no, I would just rather do the edibles, whatever. I'm like, okay, well, here, do you cook? And they're like, well, yeah. I'm like, okay, cool. So get a half a cup of oil, whatever oil you want. Get your, slow cooker, crock pot, put it in there, throw a bud in there, and then, just like I mentioned earlier with the grinding, I'll tell them, throw in some thyme, throw in some basil.
You got a teaspoon measurement there?
Throw in some rosemary, let it all marinate for about 4 hours. Now, all you got to do is put like some red wine vinegar or some apple cider vinegar or squeeze a lemon. The lemon, you got the limonene and the citrus in the lemon. Now you've got amazing salad dressing. And so, so now I'm educating them, how you can cook with it. And I want to defer, I understand you're an expert, Matt, and you got your stuff, but you know what? 100% of people that use cannabis, it is medical. The only difference is that I, as a medical doctor, am not recommending it. But we are all self-medicating, whether we know it or not.
Sure, absolutely. They would say that about addiction, right? Like I got into this trying to cure some pain. Now, it wasn't the best route. They clearly used the wrong substance for the wrong reason, but it's not escapism. They're trying to treat themselves.
Right? Yeah, exactly. No. And people that can't focus, that have ADD, ADHD, they get some good green crack, and boom.
That's right. That's one of Matt's favorite blends.
Yeah, and I'm very public about my ADHD.
Well, they made.
We had a specialist on, and we kind of went through the roof there. That was a very fast episode.
Yeah.
Like here in Florida, one of the dispensaries crossed Blue Dream with green crack, and it's called.
Oh my God, that sounds amazing.
Yeah, it's called. They call it Green Dream, and so because Blue Dream, I tell people. Blue Dream is like acetaminophen. Everybody should have it in their medicine cabinet.
No complaints here, man.
PTSD, anxiety, depression. I mean, it's just, it covers so much. And then if you're having issues with your ADD, ADHD, and you're having anxiety, and you're anxious because you can't focus, use this now and combine these two. And now it's a slam dunk.
So, Doc, can I ask you? Oh, sorry.
No, go ahead.
Can I ask you this? Like, let's say we can't get that particular strain here, but we can get green crack. We can get Blue Dream. Mix them ourselves?
Sure.
That's fine. That's good enough? Yeah.
Yeah.
All right, no, just like,
throw a little
man,
basil in there too and get things really heated up.
Throw some basil.
Oregano.
Yeah. Well, no, basil's got, I mean, all those terpenes can be botanically derived just the same as cannabis derived.
It's in the plant world. It's not.
Yeah, exactly.
It's not unique to cannabis.
To cannabis. I mean, pinene is in pine needles.
Lemonine literally is in lemons. Yeah.
You know what's crazy? We're going to have a terpene grower on the show in a couple months, and
shoot me an email. Let me know, because I definitely want to. Oh
yeah, no, Dude, this guy, I'll connect you with him if you want. He's a real nice guy. He's Tom and I's age. He's been doing, British guy, lives in Northern California, been doing it for years and years and years, decades. And he knows more about terpenes than any human I've ever met. And Steam extracts them from cannabis. It's 0% psychoactive. It's like, and he sent me a bunch, and we're actually working on formulations for Head Shop that are custom terpene blends. And what's fascinating about this is he's giving us the option to sort of like look at the constituent makeup of what that might look like, right? Tom and I are talking to a peptide guy similarly about on our side. It's
doing custom blend peptides.
Custom blend peptides. And like, between the two of those and the terpene thing, you would obviously come into Irreverent Health as well, because that is so interesting of a science, right? So he basically said, here, take this like substrate, and it was something easy, 0 psychoactive, CBD 0, less than 0.3.
Zero euphoric. It's all psychoactive because we have cannabinoid receptors in the brain.
Thank you for keeping me honest. Yes. So here's what I meant. You don't get high, okay? But here's the thing.
Not euphoric.
You put these
psychotropic, not psychic. No, that's different drugs.
You put
now you're talking about the direction I've been moving into for the past.
We're gonna get to that.
We're doing an hour on cannabis, and I'm like, dude, he's got a ketamine clinic.
Yeah. Well, so only thing I'll say is that you dust that substrate with one terpene or another, and it's wildly different. None of it's getting you high. It's all completely therapeutic, and it's ridiculously effective. Like when you add this one or that one, the effects are totally different. And the big reason is, I think they're cannabis derived versus botanically derived. And I don't know what the mechanism of action difference is, but there is something there. These things, when you're mixing it with a THC derivative or THC, those two things just, I don't know if they're like, I missed you, and they all got back together. I don't know. But yeah, I mean, it's really different. Anyway, yeah. But yeah, you can get these terpenes from anything, man. I mean,
exactly.
Lavender. I mean, yeah.
And so that's why, I incorporate these other things in there, because I let them know it's plant medicine. This isn't a gateway drug. This is medicine. It's plant medicine. And so, that when I sign off on my books, my hashtag is #cannabis is medicine, because it is.
Yeah.
So not to fast forward to this, but because we already kind of spoiler alerted it a little bit, but like talk about the next chapter. Like, how did you transition, or how did you add? Knowing more about you, I'm not actually kind of feel stupid asking this question, because I know how to add.
I mean, it sounds like a natural progression to everybody. Yeah.
I'm like, okay, but I have to ask, how do you start adding that?
It was right around COVID that one of my colleagues who. She and I got into the medical cannabis space right about the same time. And she would call me and ask me questions, and, we kind of worked together. And then she is a pain management doctor. She started getting into the ketamine, and I started seeing it on social media that she was getting involved using it for pain management, but at the same time, incorporating it with the mental behavioral health aspect of things. And, right around that time, I was the chief medical officer for marijuanadoctors.com, which was a huge platform for
I remember them.
Education and everything. They sold the company to Very Heal. And so Very Heal now owns Marijuana Doctors. And so the CEO at the time we were already talking about, psychedelics and ketamine and MDMA. And so I started following the work of MAPS and researching what MAPS was doing. And so learning more about that, because I had these patients with PTSD, with anxiety, with traumatic brain injuries. And although the cannabis was great and was helping them, it wasn't long acting, wasn't lasting enough for them. And, I want to fix the problem. I don't want to fucking put a Band-Aid on it. And so I said, okay, what's next? And so, because I'm always looking not for the next magic pill, but what's the next thing? When I was a chiropractor, I had a mentor that's in Arizona, and he's like, he invented a technique. And he told me, he's like, well, the world is zigging, you zag. Like, you want to be just ahead of the curve. He's like, you want to be a leader, not a follower. And I'm like, okay. And I always use that. So I'm like, okay, I've got the cannabis down. What's next? Like, what's my next horizon? And that's when I learned about the ketamine. And so in June of 2020, I took my first ketamine certification course and loved it. Loved the whole concept, loved the idea. But again, if I'm going to recommend it, if I'm going to prescribe it, I'm going to have to sample it.
Yeah, John Lilly said that too. The inventor
I got to know what's
sensory
up.
deprivation tanks. He was huge into ketamine.
Yeah. And the thing is, when I was a chiropractor, every week I had somebody bringing in MLM. Oh, you got to try the latest, greatest supplement. I'm like, well, give me a sample. Let me try it. If it works on me, then it'll work on my patients. If it doesn't do anything for me, it's not going to do anything for my patients. And so I did that. And so I did the ketamine, protocol, the Yale protocol, twice a week for 3 weeks. Right before I did that, I had been in Mexico. This time I didn't eat the popsicles. And I met with a shaman
bottled
down there.
water only, sir.
I met with a shaman down there, and I did the Sonoran Toad.
Ah.
And so I did the Sonoran Toad, which is right in the same vein as, MDMA, DMT, etc. And I had seen an interview that had been done by Joe Rogan and
was it Mike Tyson?
Mike Tyson. And the one line in there that hooked me was, if you expect to be okay with death, you have to experience it. Yeah. And he said, and the way I did experience death was I did the Sonoran Toad, and then I did ketamine afterwards. And I'm like,
same day?
No, he didn't do it the same day.
I was like, wow, it's an adventurous soul you are.
He took a hit off the toad pipe and then immediately got an IV of ketamine.
Yeah. I'm like, what the
Start
fuck?
the drip.
And so I did the Sonoran Toad, and then I came stateside and then did the ketamine protocol. And the ketamine was like the Sonoran Toad on steroids. It was just
really.
I would have thought that was the exact opposite.
See, because they say with the 5-MeO, it's like the blast off level is just so.
Yeah, the blast off is insane, but the duration of it, I felt that when I did and do the ketamine, that my trip lasts much longer. And
yeah, that makes sense.
I don't launch as aggressively and as quickly as you do when you do the pipe, the Sonoran Toad pipe. But I'm in that space for a little bit longer, so I'm able to work through more of my shit.
That makes sense.
Yeah.
And because of that, that's why I really enjoy using it for my vets. The TBIs, the auto accident patients, the severe PTSDs, the chronic PTSDs, the suicidal ideations, because it's a slower, gradual process, but it lasts a little bit longer. So they're able to really hone in, and we're able to peel that onion better. And then within 24 hours, I have them see one of my counselors.
Yeah. I was going to ask you about the mental health part of that.
Yeah. Exactly.
Oh, that's interesting. Yeah.
How long is the follow-up counseling? Is that an ongoing thing, or does that seem to be about as long as the course of the ketamine itself?
I have them do it within 24 hours of their ketamine session, and it's about a 50 to 60 minute session, because in those 50 minutes after having done the ketamine, it's as if they had done 2 to 4 hours of,
and that's the integration. Yeah.
Yeah, I'm
so
actually
it's
curious.
A single session, though.
I'm sorry?
single session of meeting with the therapist?
Well, I do it every week because it's twice a week.
All right.
Yeah, so it's weekly.
For
So
3 weeks,
twice a week for 3 weeks is the middle range. Because I have 3 tiers. I have the first tier for the person that wants to dabble in it, and because the science shows that by doing a questionnaire like the PHQ-9, the Patient Health Questionnaire number 9, which measures your level of depression, your numbers drop within an hour of having done the ketamine treatment.
Wow.
But it lasts right at 7 days is when you start noticing a rise in those numbers, in those scores. And so 7 days is kind of like the sweet spot. So for the dabblers that aren't really sure, I do a once a week for 3-week session of ketamine with them, with counseling after each session. And then at the end of the 3 weeks, they meet back with me. I'm like, okay, so, these are your scores when you started. These are your scores now. I've spoken with your counselor. They've shared, all these breakthroughs. Where are you at right now? What do you want to do? Do you want to continue? Are you fine? And so we engage in that conversation. The middle tier is the Yale protocol, which is twice a week for 3 weeks, again with the counseling. And then, the Maserati of it is like twice a week for 3 weeks, once a week for 3 weeks with a booster a month later. It almost compares to the esketamine protocol, which I'm certified to prescribe.
That's the nose one, right?
That's
Theirs is twice a week for 4 weeks, once a week for 4 weeks, and then a booster at the end.
A month later.
The difference with them in my program is that it's $600 to $900 a session. With the esketamine people, mine never reaches that level.
Wow.
Of fees. Yeah, they charge.
So you're making this pretty accessible, is what it sounds like.
Yes, sir. Very much so.
Is insurance paying for any of this for folks, or is this all out of pocket?
Okay, so the rules with FDA. If it's FDA approved, it's on label. If you're using it
right.
non-FDA approved, then it is off label. And so
you mean I can't get surgery twice a week for
3 weeks?
So S-ketamine is the S enantiomer of ketamine, and so that is FDA approved for treatment-resistant depression, suicidal ideation, and PTSD. And most insurance companies will pay for the S-ketamine treatments. For the racemic ketamine, which is what the alternative that I offer the patients that cannot afford, the S-ketamine or don't have insurance to pay that covers it, then we go the racemic route, and insurance doesn't pay for that because that's considered off-label.
I say.
I gotcha.
Right.
So this S-ketamine, when we talk about Mind Bloom and stuff like that, is Mind Bloom psilocybin or is Mind Bloom?
Mind Bloom is ketamine.
Are they using real ketamine?
They're not using the S-ketamine. They're using the racemic. Yeah. Either in the troche form or nasal spray. The Spravato comes in a nasal spray, but that's S-ketamine in a nasal spray. I've got a compounding pharmacy that compounds troches as well as the ODTs, which are very similar to. You remember the Listerine mints?
Yeah, the little packs.
The strips. Yeah,
the strips.
It's funny. Like our peptide manufacturers got those now. You can use it as a delivery in a strip, and I don't Tom, I don't even think I told you about that yet. But
no, because I gotta buy a box of syringes sitting right over here. I'm ready to go.
Yeah. No, I think it's awesome that people are doing all this research on the delivery mechanisms, because not all of us are Tom, right? We're not, I personally, I
have
don't
a shirt
think
that says that.
I couldn't even do the GLP-1s. I wanted to try it for the show, and I couldn't.
Boom.
I'm like, I can't
wait, hold on. I'm
needle.
holding it up in front of your face instead of in front of the camera.
Yeah.
But yeah. I mean, I've probably, I've been in acupuncture for 24 years. I don't know any hundreds and hundreds of thousands of needles I've put in people. So
yeah, right.
Certainly my threshold's a little different than, say, the average home user.
It doesn't even hurt. That's the funny thing. I'm not even bothered by any kind of pain. Like my avoidance of needles is completely irrational. So I'm just like I mean, it's not anything other than nothing. Like that's literally all. But I'm like, yeah, I'm good. So Listerine strip, you said, sign me up. I'll take two of those.
You're still probably getting a good absorption rate there. You're
so
still taking
you have to take it 3 times. The GLP ones.
Bioavailability, yeah. Well, bioavailability is the key. I don't do the IV because although it's 100% bioavailability, with the IV and the way the rules and regulations are, I have to have an inordinate amount of overhead to cover.
Yeah, just the insurance, right? Because it's pretty much anesthesia, an anesthesiologist.
Exactly. And so they have to be monitored on an EKG because it can cause an arrhythmia. So I got to be mindful of that. Their blood pressure's got to be monitored, their heart rate, their oxygen saturation, all that stuff has to be monitored. I have to have an advanced cardiac life supports provider. I have to have a crash card. It's just a shit show.
It raises your overhead, and it sounds like
it would raise the price for the client.
And that insurance sounds super cheap too.
The juice is not worth the squeeze in that case, right? You're not gaining something extra by that delivery method.
No,
right?
But if I do intramuscular, a shot in the arm or the butt, now we're looking at a 93% bioavailability that my medical assistant can inject.
Yeah, you can.
Right. Yeah, significant reduction. And those strips, apparently, like the GLP-1 strips that the guy was talking to me about, they're so poorly bioavailable that you have to take 3 a day. So you have to take 1 in the morning, 1 in the afternoon.
I mean but if they're thin like the Listerine, I mean that's
it doesn't matter. But you can't. It's not 1 shot a week. You have to do 3 a day.
Look, man,
right?
I worked at a place that was doing the HCG diet, and they're like, we're not giving.
I did that too.
But it was funny where they're like, somebody was trying to sell us a homeopathic
drops
lozenge. Yeah, and I'm like, that doesn't work. Yeah, that doesn't. And they're like, why not? I'm like, okay, so homeopathics, there's less than 1 mole of the substance in it in some cases,
right?
Exactly.
There's no atoms of it.
Like atoms.
They had these little dry pellets that they would put in their tongues, or the droppers. The drops were the ones that always got to me. I'm like, do you guys know anything about how homeopathy works? I mean, they wave the substance over the bottle.
It is so weird.
Yeah.
And they want to make more pills. They got a machine that you open one side and the gas from the one goes into the other, and you open the other and then you shut them.
Yeah, that sounds like everything I would think.
Now, that being said, I probably have 10 homeopathics in my medicine cabinet, right?
Yeah.
But, Trameal is a really good injectable for pain, which is a weird one.
Yeah, I used to, when I did pain management, because I worked at an integrative clinic in Salt Lake City, Utah.
Yeah.
And we used to inject Trameal. I refused to inject steroids in a joint unless it was like, nothing else was doing it. Nothing else was working. And it was a one and done. But, I was big into the Trameal. I was doing prolotherapy before it was in vogue. The D50, dextrose 50%.
Yeah.
Again, from veterinary medicine. Well, they're using this on freaking horses that are worth millions of dollars. Why shouldn't I use it on somebody's knee?
I mean, the PMF mats are all over the place. Those horse ones, they started in horses, and
those
now they're fucking everywhere. Yeah, those things are everywhere. I mean, and it's just funny. I think that, who knew we'd get all this good information from our vet?
Well, no, you just need to be worth like $100 million.
I mean, I guess. Yeah, sure. Yeah.
And be a massive stud.
Yeah, that's it. Your sperm has to be worth 50,000 a mile.
Are you saying my sperm's not worth that, Tom?
I don't know, man. I mean, we're going to have that doctor on soon, right?
Yeah. Right. Right. So, Doc, what's next? Like, where are we at now? Like, we've gone through the past and present. What's the future looking like?
The future is dependent on what happens with MDMA and psilocybin.
Mm-hmm. I'm not holding my breath right now. I think we got a 4-year pause on the MDMA thing, but that's just
I don't know. RFK could do something nuts. He's going to do something nuts.
Yeah, the rumor was that last year, the year before last, and last year, MAPS was talking about 1 to 2 years, but then something happened with the clinical trial. It didn't. Somebody got pissed off for whatever reason. And so they halted it. And so, but that's really, that's the direction.
Right. That's where you're going. Yeah. Sorry, I didn't mean to cut you off there.
Yeah. That's where I'm going. The magic mushroom, the psilocybin, the MDMA, because again, mental health, behavioral health is huge. And it's the redheaded stepchild. Nobody wants to talk about it. Nobody wants to address it because it's so freaking difficult. It's a very interesting client. It's a very interesting individual that you really got to create the leverage and the rapport with the person. It's not a, hi, bam, slam, thank you, ma'am, 5 minute, here you go, here's your prescription, have a good life. There's a lot of energy and time that's invested in this individual, but the benefits will certainly outweigh, when you're able to change somebody's life to the point that they're not able, then they are now able to go to a theme park. I am in the theme park capital of the freaking world.
I was going to say, we don't have too much request for that here, but I get it.
Yeah. And when a vet that could not leave his home, could not leave his room, is taking a nap, his son is in the living room playing a video game, he hears shooting, he goes back to wherever he happened to be, runs out, on all fours, doing his, routine, grabs where the sound is coming from, smashes it on the floor. Wife's looking at him going, what the fuck did you just do? Son's crying like, Dad, are you okay?
Yeah.
And a month later, he's taking the family to Disney World.
Right. I've heard a million of these stories. It's like really crazy. I mean, the psilocybin lab is right down the street from Tom and I's houses, basically. And at
Hopkins, yeah.
And 10,000 stories just like that.
Yeah,
it's crazy.
Yeah,
right.
I don't have any stories like that. I'm upset I didn't take the well patient trial when I had the chance.
Yeah.
By the time I turned it down, and then I called back, and they're like, "You a smoker? No. You gamble? No."
Yeah. Fuck.
Okay. Should I lie? Hey, I'm going to call back and lie.
Yeah. I do want to do, I like your style though about trying it, because ketamine is actually on my sort of like next top 10 list, right? It's like, all right, because it's obviously gaining a lot of traction. You're the second person we've had on the show about ketamine.
Yeah.
And so like, I feel like it's one of those things where it's time to sort of just experience that, because it's something that I have not, and it's literally just one of the most fascinating things. I don't have any trauma that I don't.
I have experience with it, but it was for the removal of a pilonidal cyst, which
so like right, yeah.
Not. I woke up and said, "Why are these ugly curtains in my room?"
No. Yeah,
I was running in a field. I don't know what was happening. I woke up with stitches on my ass.
Yeah, that's it, huh?
Well, I mean, and having come from the medical cannabis side of things, from 2010 with my buddy in Arizona, and what I learned in the late 90s, and now when I, because now we're getting ready to launch, officially, I've been doing it, here and there or whatever, and I've got a good patient base, but now I want to take it out to the masses. And in having conversations with people, the reception is 180 degrees opposite of cannabis. The minute I say ketamine, they're like, oh yeah, they studied that at a lot of the Ivy League schools. And it's been, and there's a lot of studies and research, everything. Oh yeah, that's really cool. Forget about the fact that it was, a veterinary medicine, a horse tranquilizer. Yeah. Forget about the fact that in the 90s it was, the massive, party drug, going down K-holes.
K-holes, yeah.
Yeah. Forget about
that.
Who
can forget a good K-hole?
Yeah. Forget about all of that. That's, oh wow, they're studying it here, here, and here. It's got to be good. It's got to work. Well, what's wrong with the plant? Well, no, that's a gateway drug. I'm like,
yeah.
Like, what do you think ketamine is?
Oh man, no. I mean, look. I mean, it's in our starting, in our intro for the show. Like we're saying, like they used to tell us not to do drugs.
Now they're telling us to do drugs.
Now they're telling us to do all the drugs. Do all the drugs, every one of them.
It's so amazing, and I think I do think at least cannabis kind of warmed the reception, even if it's like, you still have that visceral reaction to cannabis. And I totally, that is kind of true. They're like, no, this is more science, or something. It's
You're not wrong. It definitely is, but I do think
wrong.
there's a little bit to what you're saying too. It's like the oldest child breaks through the barriers, the middle child gets away with more. The bottom child they don't even care about. They're like, whatever.
They're just do whatever.
Yeah. By the time we get through this, any other drug for the rest of humanity, everyone's like, just pass it. Who cares? Like, let's.
What is this? Okay, great.
Yeah, I mean,
how many of these do I take?
I don't fucking care. What frog am I eating? Like, I don't know. Just tell.
Wait, is this endangered?
Yeah, you're right. Yeah.
But I mean, that's the trajectory and that's the path. So, looking forward to waiting to see what RFK does. He excites the hell out of me. I'm not going to lie, because of his thought process and everything. I hope that, he didn't get gun shy after, the raping he got, during the committee hearings. But
I mean, listen, I am on the health and wellness side. I'm excited by the words that he says.
Mm-hmm.
On the, we started a show called Irreverent Health side. The guy's fucking batshit crazy, right? Like, so like I'm on both sides. I can very lucidly see both sides of this coin. And I think that's what makes him an interesting conversation topic because, he's got some really excellent points, such as why can't a doctor prescribe a gym membership? And I'm like, that's a great idea.
That's a great idea. Also, maybe we don't want Roundup in our food. Great idea.
Right. And like I said, they're not bad ideas, but here's the thing, man.
Here's a giant plate of raw meat and raw milk that you should eat every day.
Yeah. Maybe
wait, he killed a bear and buried the body in Central Park. That's fucking weird, right?
Yeah.
Like, that's insane.
Yeah. So, but like, here's the thing. Like, I can't believe that the world is ready for some of those things. Like, I don't know anybody, even my health conscious friends, who, if they get to the point where they're at the doctor and the doctor goes, here's a gym membership as your cure, it'll take 6 to 9 months. Everyone's like, yeah, doc, go fuck yourself.
Wait, hold on. Insurance is paying for my gym membership. I'm a happy man.
Well, no, you are.
Yeah.
But if it came down to
that's
like
a couple $100 out of my pocket every month,
but if it came down to that, or getting a shot of GLP-1 inhibitor.
Correct. And I'll do you one better. Here's your choices.
We're going to pay for your membership right there.
Yeah, we're going to pay for your membership for 10 years, or you have to pay out of pocket double the price for a GLP-1. It's GLP twice, all day, every day, twice on Sunday, man. There's no fucking way.
That's the American way.
That's exactly my point. That's why I'm like,
microwave.
Wait, hold on. Eat a vegetable and give myself a shot.
Yeah, are you fucking crazy? That is green. Fucking off.
Maybe don't eat the entire pie or a little shot.
When I was in Arizona... When I was in Arizona, we were starting the interdisciplinary clinics, the MDDC clinics, and for auto accidents to get more bang for our buck. The medical doctor would see them, would refer them to the chiropractor for chiropractic care. If they needed medicine, the MD would write the scripts, and so everybody everybody tapped the market. Everybody got everybody ate.
Sure,
but for cash, they went the fen route, phentermine, phentolamine. And, we all know what happened after the fact.
Yeah.
But there were women that came into my office that said, I don't care what it is. I don't care what it costs. If all I have to do is take a pill and I'm going to be skinny, give me the pill, doc.
Yeah, no, 100%. And that's exactly where I think
look,
this reactionary plan is probably not going to be the most effective, just because people aren't going to do that, man. I mean,
look, man, it's insanity. Even every once in a while, we hear a story of a woman getting a bubble butt in somebody's kitchen with fucking caulk.
Yeah.
You're like, what? Your friend said she could do it for nothing? Oh, maybe she's not the person we should be seeing for this.
Yeah. Oh my God. Yeah. I mean, look, I'm super psyched that this is becoming a thing we can all talk about and do. I'm excited that in the world that this show exists in and all the people that we get to talk to in it. It's never been more exciting, I think, to be in this sort of circle of academic pursuit and practical pursuit. Yeah, it's just everything about it's amazing, and I love that you took time out to talk to us about it.
Yeah,
I appreciate you inviting me. The fact that we connected, it's phenomenal. Thank you.
Yeah. Man. So how do we find you? How do we point people your way? What's
the easiest way is going to my website, josephrosadomd.com, josephrosadomd.com. On there, I've got all the links to all my social media platforms. I also have a YouTube channel. That's the Dr. Rosado Show. You can, people can go to YouTube and Google, search Joseph Rosado, MD, and marijuana, and they'll see an interview I did with Jordan Belfort, the Wolf of Wall Street, that I did in Beverly Hills in his studio out there. There's an interview that I did with Montel Williams. So that's there, but also lectures that I've done all over the world, Canada, Malaysia, Fiji, Houston, Texas, etc. So a lot of that, both in English and Spanish, as I mentioned earlier. And then on Amazon, they can go to Amazon and put, Joseph Rosado, MD, and medical marijuana, and my 7 books will populate. And the first one, Hope and Healing, The Case for Cannabis, which is available in paperback, hardcover, English, Spanish, audio, and Kindle. And then the other 6.
That's awesome. No, it's great, man. I'm super psyched. We'll put all that stuff in our on the episode list, and we'll get back to you with a link to this and everything like that when it's up. But man, dude, so nice having you, dude.
Great conversation.
It was great conversation. Yeah.
No, now I can. It was really fun. Thank you. I enjoyed the hell out of it.
Yeah, that's awesome. Thanks.
Like that's all we aim for is like, let's give the guest a good time, and
it really was nice.
Get a great show.
Yeah, dust off a little actual medical marijuana for a change. Yeah. So that's nice. Thank you for letting us explore that for a minute, because we just don't.
We got a homeopathic practitioner coming on next week.
Yeah. Well, we absolutely.
Hopefully they don't hear this.
Not air before then, because
yeah, exactly. All right, Doc. Have a good one. Thanks, guys. Appreciate your time.
No, thanks to you. Appreciate you.
Later.
Be subversive, irreverent.
Health is wealth, but you knew that.
Everybody knows that.
But so is following us on social media at Irreverent Health. And check out our website for more exclusive content at irreverenthealth.com.
Oh, I like this.
Thanks for tuning into this episode of Irreverent Health.